Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. Joining me today is Amy Brown, the founder and CEO of Authenticx. Amy, how are you?
I'm good. Thank you. Thanks for having me.
I'm excited. You're getting me on 3 cups of coffee. I'm ready to go.
Awesome.
Let's let's
Love
let's kick it
to.
off. If you don't mind, we'd love to hear more about your background, and then we can dive more into Authenticx.
Yes. So my background, I grew up in the Midwest, daughter of a physician, and pretty quickly in my kind of secondary education realized I was not going to be following in the footsteps of a clinician. That said, I became, through my education, really fascinated with healthcare systems and healthcare policy. And so started my career in state government working on healthcare policy related matters with served two governors. And then after those early years of my career, I left and spent the next 15 years working in the private sector, mostly in the health insurance space, but I also worked a bit in life sciences. And my roles were always focused on the operations of the business, which meant we were talking, my teams were talking to patients and doctors every day. And they were talking through call centers, which included, calls, chats, emails. And what I learned over all of that time was that these conversations had so much insight in them that could actually, if harnessed correctly, if listened to effectively, could actually inform the entire enterprise of a business. And yet we were not leveraging that data source at all. And so that was both the problem and the opportunity I saw. And so um, after 20 years in the healthcare space, I left my job and started Authenticx. And at that time, I was and still am a mother of four kiddos, and my husband was a stay-at-home dad. And so it was a big leap of faith, but one that has paid off.
And talk us through the. Thank you so much for your story and learning more about you. Really appreciate that. Um, and to do all of that and and have 4 kids is no easy task. So kudos to you and your husband.
I like challenges, apparently. So,
You like you're really good. I'm guessing with the schedule and being able to be super efficient because you can't have 4 kids and do what you do and and be inefficient.
you have to
That's
be. Yeah.
awesome.
Thanks.
Well, can you give us some highlights of the company? What do you want people to know about Authenticx? Offering services. Talk us through some of that.
Yes. So, what our mission really is to help the healthcare industry listen at scale to the customer voices that flow in every day to their organization. We serve pharma payers and providers. We serve enterprises, and we are a SaaS company. And what we do is we work with leaders within these organizations to acquire or ingest their conversational data. And then we use machine learning models that we have uh, curated ourselves, built ourselves, that are specifically designed for healthcare use cases, to listen for the things that matter most, both to healthcare consumers as well as the different stakeholders in the healthcare system. So we might be listening for, where are the breakdowns in the customer journey that are leading to people missing their medication refills, or what is causing the most friction between providers and the insurance space, and how do we help inform leaders who can make changes to their process to improve that. There's a whole slew of use cases, and we're really focused on both quantifying this data for them, for leaders, as well as telling the story around the data points so that leaders have a really contextualized understanding of what's going on in their customer conversations and where to prioritize action.
And Amy, talk us through um, something I was really interested in diving more into with you is why, for instance, why speech data analytics? Why is this an essential tool for the healthcare industry? And and there's many parts, right? Pharma, insurance, providers. I would love to hear your thoughts on that.
Yes. Well, a couple decades ago, all industries really realized that in order to be competitive, they needed to start really understanding what customers wanted, and they needed to differentiate based on customer experience, not, because no longer could they differentiate based on price or product. And this was no different in the healthcare industry. And so for the last 20 years, the source of customer insights has been surveys. We all have gotten surveyed after an experience with any kind of business, including our healthcare providers. And what we're trying to say is, look, customers are talking to you every day without being asked. They are telling you what they need, what they want, what's frustrating them, what they like, and they're doing so in their own words, unsolicited. It is a much better source of truth, and it is universal, meaning it's you have access, leaders have access to all of the interactions that are flowing into their organization. They're not just relying on the fraction who decide to actually respond to a survey. And so we believe that conversational data is much more contextual. It's more representative of the truth, and you're going to hear things in a very different way, in a much more complete way, an authentic way than you would if you were just relying on a survey score and maybe a note or two that the respondent, wrote in the survey response.
Now, how can healthcare organizations, better leverage the power of technology to really unlock these rich conversational data insights, and not just to do that, but with the hope of improving the patient experience. What does that look like? Give us your thoughts, and then also take it back to how you're helping do this with Authenticx.
Yes. Well, these organizations in our, healthcare system, they're pretty large, and they host many, many conversations, too many for human beings to wrap their ears around them. And so they must rely on technology to help them sort through the noise and pick up the themes of what should they, the leaders, be really paying attention to. And so through AI and machine learning, for this data source, conversational data, we can start to organize and put together key topics, themes, emotions that exist within the patient base or the customer base. And this is super important for leaders to figure out what to prioritize. And so, for example, in an insurance client, we might be able to identify that last quarter's multiple millions of conversations showed a 30% prevalence rate of people who are frustrated with the claims process, and specifically the process of paying a bill after receiving a claim, right? And so leaders can see that and say, wow, that's our biggest complaint, is our claims process. Now let us drill into this conversational data to understand it a bit deeper, and then devise a strategy and a plan that will actually allow us to reduce that rate. And through ongoing listening using this data and using AI, you can actually measure whether the changes you're implementing as a leader are having the intended effect. And that's how Authenticx helps. We help by providing software, and really smart people that consult with our clients on how to take best advantage of this data source and to turn it into something that is, for the first time, getting out of like this dormant state and actually providing insight to the entire enterprise.
What's next for you and for Authenticx, Amy, that you want to share with the audience here today, that you can share with us here today? What gets you excited as we head into 2023 and beyond?
Yes. Well, we just closed our Series B fundraise. It was a $20 million fundraise, and the proceeds from that fundraise are going to be used to really make a bigger impact in the healthcare space. So we have been a fast growing company. We intend to grow more than double this year, and so we've put in place some things to make sure that happens. And what I'm really excited about is going beyond kind of just understanding the data and what people are saying and the emotion behind it, and solving actual healthcare problems, like identifying when customers are experiencing gaps in care and therapy, and getting those insights into the hands of clinical teams who can actually do something about it. So I'm super excited about all of the use cases that come from conversational data, and I know that this is going to be transformative for the industry.
Well, I'm really excited to continue the conversation with you and hopefully have you come back on again. Maybe get you on a panel around some of the things that you talked about here today. But again, congratulations on the raise. Super excited for you and the team, and would love to stay in touch. And again, let's get you back on here to dive into some of these topics even further, maybe with a group of your peers, which I think would be a ton of fun.
Absolutely. Thanks so much, Jared. Appreciate the opportunity here.